Okay, so you guys, we want to talk about a blood draw. So anytime we need to do a blood draw, remember they have like a bluish color to their feet. That's called acrocyanosis, and that's completely normal. But what that does tell you, there's not a lot of blood in the foot. So we need to encourage blood flow to the foot. So how we would do this is we would use a hospital-regulated warming device. We would never use a diaper or a towel, as it could be overheated. There have been many lawsuits where nurses have put a washcloth in the microwave and heated a foot and got second-degree burns. So we always use a hospital-regulated heating device. We'll put it on the foot, and then we're just going to wrap our foot for a few minutes, and we're going to let blood flow get to our foot so that we can have a successful blood draw. So that's how we do that. Scissors, do we have scissors? It's okay. Oopsie. Okay, well, you'd want to have your scissors, so that's what we have. Okay, so we're going to let blood get to that foot. Okay, so we're going to time lapse, and we'll say that it's maybe been 5 minutes. So we'll take this off, and of course this will be nice and warm, the extremity. So to get our blood draw, what we're going to have to do is, of course, clean the foot. You're going to clean the foot, and you're going to put your thumb on the walking surface, because there are nerves that run straight down the middle of this foot that we do not want to puncture. So we're going to go to the outer lateral aspect as our favorite place, but we can also go medially here as well. We're going to use our lancet. Well, it's actually it's a larger lancet, and you can see that's a little blade right there. And we're going to take that off, and again we're going to hold the walking surface of our foot. And then we're going to take our lancet, and then we're going to deploy it, and that will give us a puncture wound. If we wanted to get a CBC, we would scoop this blood, and then there's heparin in this tube. So you need to gently agitate the blood to get the heparin in the blood so that the specimen does not clot. So you will want to keep scooping the blood until you're finished. Now we could draw and that would be for a CBC. And of course you want to keep irrigating the CBC until you get it to the nursery so that this does not clot. They cannot run a CBC on a clotted specimen. We can also do a bilirubin level, and you can see this is brown. And so the reason why this tube is brown is we know the ultraviolet light can change the bilirubin. It can change it to lumen rubin or lumen nubin. So if we had a high screening bilirubin, then we could do a diagnostic total bilirubin with this, and we would do the same thing. We could puncture this inner side or this outer side, and then we could scoop the blood and send it to the lab. This one, it doesn't matter if it clots, because it's going to give us a total bilirubin, and then we'll actually have a diagnostic result from that. Of course, you want to make sure that you have hemostasis on your heel, and hold a 2x2 and put a Band-Aid on your baby to make sure that we do not soil the linens. And so you always want to make sure that you have hemostasis prior to moving on, and you will put your Band-Aid on the heel stick. And there you go. Thank you so much.